Junior doctors have begun their longest strike in NHS history, piling pressure on the health service as it faces its toughest ever start to the year. The walkout will last 6 days and will impact almost all routine care, with consultants providing cover. Urgent and emergency cases are prioritised.
Strike action will push the total number of cancelled appointments to more than 1 million this week, and comes as the NHS struggles with additional pressures from surging winter viruses. The British Medical Association is demanding a 35% pay rise for junior doctors, but the government says this is unaffordable.
Joining us now is co-chair of Keep Our NHS Public and retired consultant paediatrician John Puntis, and also former NHS Trust chairman and health policy analyst Roy Lilley. Thanks for joining us, both of you. Let's start with you, if we can. What the junior doctors, they seem to be out on a limb here, and they're demanding 35%. All other elements of the medical strikers have done their deals, much less than 35%. If the government gives them the 35% they're demanding, then all the consultants, the nurses, the junior doctors in Scotland who've already done their deals, they'll go back out on strike. They're on a hiding to nothing, aren't they?
Sorry, you asking me or John?
Well, John, sorry.
Okay,
where you go, John?
Okay. Well, the consultants, of course, haven't settled, although they've had an offer put to them, but they've yet to vote on it. Juniors, I think, have a very strong case in terms of their pay erosion, and I don't think they actually imagine that they will get a sudden payout of 35%. So I think they are in negotiating mode, just as the Scottish doctors were, who actually settled. And what they've asked for is pay restoration, not necessarily in one go. They've asked for the review body to become more independent of government when it makes recommendations in terms of pay rises. And they've asked that thought be given to how this huge erosion of their pay that's happened over the past 13 years can be prevented in the future. So I think the onus is very much on government to come up with an offer to the juniors that they will accept. It has to be more than what's on the table so far. There was some indication from the Health Secretary that there might be another offer, which then actually wasn't produced. And it's no surprise that the juniors have decided to take further strike action. I think that was very predictable, and it could have been avoided if the government had wanted to. And if they simply don't
avoided
know...
if the doctors wanted to as well. Roy, does it worry you that patients will be dying because of these strikes?
Well, of course it does. It worries everybody. I mean, you can see it, I can see it, the dogs in the street can see it. The longer you wait for treatment, the more critical you're going to get, the worse your clinical priority gets. I mean, I think during the strikes, to be fair, I think the blue light front door, A&E and ITU and things like that are pretty safe because the consultants are there. But what's happening now is you're getting 1 million people bumped off the waiting list. Some of them have been bumped off 4 or 5, 6 times. And they're not on a waiting list for fun. They're there because they need a diagnostic, so their symptoms will either go away or get worse. You've got people who've got query cancer. You've got people with heart problems and goodness knows what else. You've got people marooned in their flats because they can't get out because they've got a hip they can't use. And we know that it will all get worse, and we know it will take months to bring the waiting lists down for people who need inpatient care. So, yes, of course it worries me.
Going back to you, John, I mean, it's interesting, you are co-chair of Keep Our NHS Public. It strikes me that I agree that a lot of sectors, not just medical workers, have seen real-time wages decrease due to the cost of living crisis over the course of a number of years. But if the money just isn't in the pot for the NHS to pay right now, which politicians would say it isn't, the actions of these doctors are actually driving patients to have to go to private practice, which is kind of the opposite, surely, of what you would stand for.
Well, I think the money could be found if there was a political will, just as we saw during the COVID pandemic. Suddenly money becomes available if there is a political will. And we need investment in our health service. The reason that things are so bad at the moment is actually underinvestment. You know, we're spending 40 billion less a year on healthcare than comparable European countries. And it's no good saying, yeah, it's record funding. It's meaningless unless you put that in the context of demand. And the NHS is so under-resourced. It doesn't have enough staff. It doesn't have enough beds. Other parts of the system, like social care, have been badly run down. And this is one of the reasons why there's such long waiting lists, as Roy alluded to.
Well, thank you, John. Thank you, Roy.